you ready?
I'm ready when you go.
Okay. Can you talk to us a little bit about that? What you're going to be, can you do this within this short space of time that you have been appointed to in the beginning of January?
I think there are a lot of things that we can do within a very short period of time, largely because this is an issue that's been discussed for years. There have been studies on this, there's been research on this, there's been legislative proposal after legislative proposal on this. It's clear that the Medicaid system in Illinois is both broken and spending far more money, and the increases are going up far much more than they should be every single year. We need to bring that growth down and make the system better for the people who depend upon Medicaid to access reasonable preventative health care services. So I'm encouraged. I hope this is an opportunity to have a serious discussion about these issues within a relatively compact period of time, and then get some things enacted that will really make a difference.
Do you see a movement toward managed care?
Absolutely. I think that is a key part of this. Of the neighboring states around Illinois, all of them have between, I think, 60 and 70% of their Medicaid populations in a managed care program. In Illinois, we're at about 10 or 11%. That's part of the problem, but that's only one issue. But it is a big issue.
Because I think there's a Medicaid managed care pilot program going on right now, authorized by legislation last year.
There is, and again, it's a very, very small piece of the pie. One of the virtues of waiting so long to do something on this, which is not good, but one of the virtues of waiting so long is we can now look at other states and what their experiences have been, and that experience is clear that if you do it right, if you write the contracts with the managed care entities correctly, and you design the program to fit well, that it's a cost saver and it's an improver of health care.
What other issues of Medicaid are you going to be looking at?
I think there are serious issues of eligibility, and what I mean by that is that over the better part of the last decade, the administrative wing of state government, the executive office, hasn't done the job it needs to do to make sure that the people who are actually eligible for Medicaid services are the only one accessing Medicaid services. Particularly over the last several years, the administration's policies have been kind of throw it open to, well, once you get on the program, you'll never have to leave the program, even if you no longer fit the criteria. That's not what taxpayers pay for in a Medicaid system, and we need to get a handle on those eligibility issues.
Blagojevich did open up a lot of programs, opening up Medicaid to family care and such. Do you see rolling those back to a more reasonable eligibility level?
Well, I do, particularly in the All Kids portions of the All Kids program. There's literally no income cap.
Right.
It doesn't matter how much you make. Now, that's not Medicaid in the end is a public assistance program.
Right.
It's for people who need the taxpayers' help in order to access health care services. Public assistance programs should be limited in terms of their income. They should be means tested, and this one isn't. That's part of the reason we're paying so much more money than we should have to for the program now. We absolutely need to put an income cap on that program.
But that's not Medicaid. All Kids isn't Medicaid.
Well, it's not because we don't get a reimbursement for it, but it falls under that general banner. That's exactly right.
One final question. I know the federal health care reform is going to be tinkered with, naturally, but I assume there's going to be added extra urgency to reform Medicaid, since the Medicaid rolls will swell by 2014.
There should be, because the conservative estimates are that as a result of the federal health care legislation, Illinois is going to have about 600,000 more people added to the Medicaid program in Illinois by virtue of a federal mandate, and then in just a few short years after that, there will be no more assistance from the federal government in order to pay for those, which means that the Illinois taxpayers get to shoulder that burden as well. So to get our system in place and get it ready to try to absorb that, and I'm not sure we can anyway, but let's put our system in the best position possible to be able to deal with that. You're right, it is a matter of urgency that we get it done soon.
When's your first meeting scheduled?
I think for maybe just a couple weeks, maybe when we come back, which is good. We've got some work to do. We've got to get some people lined up insofar as witnesses and get all our materials together. But we've been having this conversation. We've been urging this for 8 years now, and so we're really ready to go.
It's exciting.
It is. It is. We hope it's a real opportunity.
Thank you so
You bet.
much.